I'm Joyce O'Shaughnessy, the Celebrating Women's Chair in Breast Cancer Research at Baylor University Medical Center, Texas Oncology, and U.S. Oncology in Dallas, Texas. The question about whether postmenopausal hormone replacement therapy increases breast cancer risk is a very important question that has been studied now for several decades. The most authoritative trial to address this was the prospective randomized trial, the Women's Health Initiative. And in this trial, tens of thousands of women were randomized to hormone replacement therapy, menopausal hormone therapy, or not, and were followed. Women who did not have a uterus were randomized to conjugated equine estrogen versus not, and those with a uterus received both estrogen and medroxyprogesterone acetate and the progestational agent. And with now mature follow-up going out 10 years or more of median follow-up, interestingly, what was found in women who received the conjugated equine estrogen alone without the progesterone because they didn't have a uterus was that there was a somewhat decreased risk of developing breast cancer, a decreased incidence, and interestingly, a decreased risk of breast cancer mortality. Conversely, for women who received estrogen and progesterone replacement therapy, there was an increased risk of breast cancer in those patients. After a median exposure of a little over 5 years to estrogen and progesterone and a little over 7 years to estrogen alone, the Women's Health Initiative cohorts were terminated. The studies were stopped because the overall risk to women's health outweighed the benefits of the hormone replacement therapy. In the estrogen plus progesterone group, it was an increased risk of breast cancer. And in those receiving estrogen alone, there was somewhat of an increased risk of dementia. And so overall, on balance, there was not a benefit to women's health in general in these overall populations. So it's very interesting that there was a decreased risk of breast cancer mortality with estrogen alone, and that is contraindicated by the UK's Million Woman study, which found that both estrogen alone or estrogen plus progesterone increased the risk of breast cancer. And so the Million Women study is an observational trial. The Women's Health Initiative is a prospective randomized trial, which is, of course, the gold standard with regard to the level of evidence. The other thing that was found is that the longer a woman was on estrogen plus progesterone, the higher her risk of developing breast cancer. If she was on a short time, less than 5 years, within 5 to 10 years, her risk of developing breast cancer was down to the population average, so it dissipated. However, if she was on hormone replacement therapy for a longer period of time, then that risk of developing breast cancer could actually continue beyond the 5-year mark. Women who received estrogen alone, they had the most favorable impact on decreasing the risk of developing breast cancer and the risk of dying of breast cancer if they were more than 5 years out from becoming menopausal. So on balance, what we can say is that with regard to estrogen plus progesterone, there is an increased risk of developing breast cancer with that combination. However, that is a very, very small risk for women who choose to take the estrogen plus progesterone for a few years around the time of initial menopause. But it's as women take it for longer periods of time, the risk of breast cancer goes up over time and is likely not the best strategy, and alternatives should be evaluated. For women who don't have a uterus and can take estrogen alone, in the Women's Health Initiative, the median duration of therapy was a little over 7 years, and that appears to be safe. However, we really don't know what the risk of breast cancer or other health risks would be with continuing to take the estrogen for 10, 20 or more years. We have to be cautious about what we don't know about the duration of therapy. There are certainly positive effects of taking hormone replacement therapy, such as increased bone density, genitourinary atrophy, preventing atrophy, quality of life, cognitive and sleep issues, etc. But with regard to breast cancer risk, longer duration estrogen plus progesterone therapy clearly increases the risk of breast cancer.